Welcome back. September is Ovarian Cancer Awareness Month. Did you know that 60% of women diagnosed with ovarian cancer are already in stage 3? Here with more on the symptoms and preventative tips you can take now, Dr. Vikas Gupta, an oncologist at Healthcare Partners of Nevada. Good morning to you, Doctor. Welcome.
Good morning, and thank you for inviting me here.
Yes, our pleasure. Now tell us about ovarian cancer and what causes it.
So when we talk about ovarian cancer, there are different types. 90% of the time, it starts from the outer covering of the ovaries, what we call epithelial ovarian cancer.
Okay.
Now there are other types like germ cell tumors or stromal cell tumors. So by a rough estimate, there are going to be about 22,000 new patients in 2014. But the sobering fact is that 70% of them will be diagnosed in late stages.
Why is that?
That is true. I mean, the early symptoms, there are no early symptoms of ovarian cancer. And when it causes symptoms, some of the early symptoms can be vague abdominal pain, some pelvic discomfort, some bowel habit changes, some bloating of abdomen. And you can imagine patients as well as healthcare providers will just dismiss these symptoms because they can be caused by so many other things.
Right, or just like the monthly time that women go through, that you go through change, you think, oh, this is just part of my cycle.
Absolutely, and by the time the symptoms are severe enough and it's already advanced stage.
So you cannot ignore it though.
You should not ignore that, and that's where we should educate general public. And that's why we are having an ovarian cancer awareness month.
Is there a test you can take as well?
Test for diagnosis or for screening purposes. So there are two different things.
Okay.
So screening is when we try to diagnose a cancer at an early stage. Okay. So the idea is that it's an early stage and there are higher chances of cure. So far, unfortunately, there is no single test or number of tests which can accurately diagnose ovarian cancer. So experts don't recommend mass screening. They don't recommend screening of everybody. Now there are some high-risk women. For example, women who have a very strong family history of ovarian cancer, and there are some genetic syndromes which you may have, or there's a history of those genetic syndromes in their family. Those women may be considered for screening, and usually we do the screening by either a sonogram or doing a blood test, doing a cancer marker called CA-125. But all of these testing have false negative and false positive, and that's the problem so far.
Now, if someone is concerned they may have it or going through some of the symptoms that we just mentioned, what do they do?
So first of all, knowing the symptoms, that's the most important thing. If you have these kind of symptoms or you have a strong family history, you should immediately contact your doctor and bring it out, these symptoms. Your doctor may take your family history in detail and then order some of the early tests. And
you mentioned some of those tests, the sonogram. What does that do?
So sonogram is basically ultrasound. You can do it what is called transabdominal, or you can do a transvaginal ultrasound, which can have higher sensitivity to pick up any early developing lesions or masses in the ovaries.
So we have that as one method though, and what are the other methods?
And we can do a blood test. There is a cancer marker called CA-125. Which can be done, which can be high if you have ovarian cancer, but it can be normal also. So there is no single test which will predict ovarian cancer. It has to be taken in totality.
Let's talk about the treatment. If you catch it early enough, what do you go through?
So once we diagnose ovarian cancer, the first thing usually is surgical staging, which means patient goes to a gynecologist, oncologist. Except in the most early stage of cancer, which means the cancer is just limited to the ovaries, the surgery usually involves removal of uterus, removal of ovaries. Surgeon will look inside the abdominal cavity and will maximally debulk the cancer, which means he'll remove all the gross visible areas of disease. And typically that's followed by chemotherapy, which will last for several months. And then you go on a surveillance program.
Okay, and let's talk about some preventative measures that we can take to hopefully just avoid this situation altogether.
Yeah, so prevention, so for any preventative program, you got to know the risk factors of something. And the most important risk factor for ovarian cancer is strong family history or having a familial genetic syndrome. The problem is we cannot change that. We cannot change a family history, we cannot change the genetics. But awareness is the key. So if a women have a strong family history and or they have this genetic predisposition, they should be aware of the symptoms, watch out for them, and contact their doctor immediately.
And what about smoking? Does that play a part?
There are other risk factors like smoking, infertility. They have been associated with slightly increased chance of ovarian cancer. So generally speaking, avoidance of smoking, healthy lifestyle is always recommended.
It's not a death sentence, right, doctor?
No, no, absolutely not. It's not a death sentence. There are women who are definitely cured from this disease.
And you guys are committed to delivering the highest quality of health care to people here in the Valley. Tell about some of the other services that you provide.
Well, Healthcare Partners of Nevada, they host a number of events throughout the year, throughout the Valley, in order to inform patients and general public. I will suggest going on to hcpnv.com, and you can also follow us at Facebook and Twitter. Yes, Healthcare Partners is committed to enable our patients live a fulfilling and better life.
Well, doctor, thank you so much. Some great information for us this morning. Get yourself and your loved ones the health care they deserve. To find out more about Healthcare Partners and the many services they offer, visit the website on your screen. They're also on Facebook and Twitter. Still to come on